Welcome today. Thank you for giving me the time. When I was first asked to come speak today about sport as a public health tool at a Sport Innovation Summit, I took some pause. Because how does sport innovation and public health combine? And that's what I'm hoping to tell you today. So thank you for your time, and I hope by the end of this talk, you will see as well as I do just how important public health is and just how important sport is in that mission. I come to you today not only as a doctoral student in health policy from Harvard, but also, perhaps more importantly, as a former athlete. Whether it was t-ball with a really bad haircut when I was at 6 years old, running track and field and cross country in high school, competing in the national championships 3 years in a row for rowing at Harvard, sport has been a fundamental aspect of my life. And it's from this perspective that I came to understand just how important sport is for health. So when I began my career as a public health professional, when I began my education, and I started thinking about the core tenets of public health, health promotion, injury prevention, disease prevention, and when I was looking around me to see what others were doing, and they were doing very important things. Installing bed nets to prevent mosquito-borne illness across the globe. Using filtration systems to provide clean water to individuals in countries who don't have that luxury. Those things were not what appealed to me. What appealed to me was what I knew, was sport, and understanding just how sport fits into the puzzle of health. How sport interacts with everything we know affects individual health and collectively the public's health. How it interacts with nutrition, sleep, healthcare costs. And so for me, understanding this fundamental question has been central to my education and my mission as a healthcare professional. When I say health, of course we think about the bodily systems. We think about health in the commonplace sense of physical health, whether it's cardiovascular health, musculoskeletal health, neurological health, but also if you're thinking of sport, physical activity has many other broader health benefits. Benefits including increasing attention in youth who participate in physical activity and competitive sport, increasing pro-social behavior, improving sleep-wake cycles, and you can imagine that understanding how sport fits into this picture is very important. It's important because sport is a universal language. As a former athlete and a current fan of athletics, came to realize when you speak about sport, whether you're speaking in English or Spanish or any other language, people understand. Sport is universal. And so communicating about this universal topic with another universal topic of health became my mission. I don't think I really have to tell you why health matters. The World Health Organization, back in 1946, declared health a fundamental human right. A right that should be inalienable. A right that should not be based on race, religion, political belief, socioeconomic status. And when they were talking about health, they were talking about not just the absence of illness, but rather a complete physical, mental, and social state of well-being. So what does sport have to offer when it comes to health? Many studies have been done, and you'll be hearing probably about many technologies that exist to help us refine these answers. Sport affects all aspects of health, and it does so almost universally positively. Sport reduces the risk of cardiovascular disease and the related morbidity and mortality. Sport has positive neurological effects, both directly and indirectly. It moderates the sleep-wake cycle, which improves cognitive functioning, but it also improves cognitive functioning on its own. It improves fine motor skills. It reduces the symptoms of dementia in older individuals. Sport has a lot of positive health effects. Sport increases your lung capacity and your lung efficiency. It has many psychological effects, mental health effects that are very positive, increased self-esteem, improved body image, decreased depression and anxiety, improved overall psychological well-being across the age spectrum. Participation in sport leads to strong bones. It prevents osteoporosis in older individuals and prevents bone breaks in that same population. It may seem obvious, but participation in sport reduces the risk of type 2 diabetes, and it reduces your stress levels. It's been shown to reduce the levels of cortisol, a stress-related hormone. It may also seem obvious that chronic conditions such as obesity and obesity-related mortality are improved by sport and physical activity. But if you want to have your mind blown, sport actually reduces your risk of cancer. Not only getting cancer in the first place, but if you have cancer, activity reduces tumor rates of growth. And if you've gotten rid of your cancer, participation in sport and physical activity reduces the rate of recurrence. We've known this for some time, but just recently we found out the mechanism. And this is across the life spectrum. This is an intergenerational issue. Children with healthy and active parents, parents who participate in sport or physical activity, are more likely to do so themselves. Conversely, children with parents who are sedentary are less likely to be active and to gain all of those physical health benefits we just talked about. And beyond those physical health benefits, being active, being participatory in sport and physical activity leads to higher test scores, leads to increased college admissions and retention rates, reduces the risks of negative or risky behaviors in youth and adolescents, such as illicit drug use, smoking, early pregnancy, and inappropriate sexual behavior. Children who are active as youth end up earning more as adults. They have lower health costs and they're more productive in the workplace. So participation in physical activity, participation in sport, has a lasting health impact. So when we think about the continuum of health, when we think about how sport affects these things, it becomes very obvious that sport plays a major role in all facets of health. That sport will actually reduce health costs at a population level. But the question is, how do we translate these individual effects, what we know sport can do for one person, to what sport can do for a population? How do we bridge that gap? Luckily, I'm not the first person to think of this. The United Nations, hopefully many of you have heard of them. The United Nations sees sport as a positive health tool. Not only do they see it as a positive health tool, they see sport as a possible tool for world peace, for social and political development across the globe. And so when we distill down what the UN has to say about public health intervention at a population level using sport, it comes down to two things. Sport provides the benefits of the direct physical activity, everything we just talked about, all of the physical and mental health benefits. But sport also provides us with a platform. Sport is that universal language. Using sport, you can communicate, educate, and mobilize socially to achieve an important public health goal. And many of the important goals that we're talking about will be, many of the important initiatives we'll talk about work on both of these levels. So for example, the Magic Bus program. This bus program was instituted in one of India's largest slums. Children there have no access to a place to participate in sport. And so all the program does on its face is allow children to access an area to play sports safely. At the participatory level, this obviously improves health outcomes, utilizing native games, cricket, soccer, football. They promote physical and mental health. But beyond that, they introduced programming to address problems in the native environment. The caste system is still strong in India. And as such, there were communal tensions. Reducing the communal tensions by allowing children from multiple castes to interact with each other in a positive way through sport was one of the goals of this program, and it has been successful. Gender inequality is unfortunately a problem for India. Allowing boys and girls to participate in games together helped change perspective. For over 18,000 young Indians to date, this program, through sport, has changed their lives. And it's just one of many such examples. This doesn't just have to operate on the community level. This doesn't just have to be an individual creating a program in a specific environment. I know we have some soccer club owners with us today. The club from where I'm from, Kansas City, Missouri, Sporting KC, initiated a program. Once they were integrated into the community and they became familiar with the plight of some of the underserved youth, the fact that the youth could not play soccer because they didn't have cleats, they didn't have the appropriate equipment. They began the Recycle the Game campaign, allowing their fans to engage. We've talked about fan engagement. Fans engage positively with the community to rally around a public health issue, to allow individuals access to sport who otherwise would not have had the opportunity. So fans would come to the park, bring their new and donated or slightly used to be donated soccer gear. And then shortly thereafter, Sporting KC held a clinic, allowing the youth in the area who did not have the appropriate equipment to join in, to learn about the fun game of soccer, to engage with one another, to engage with the players, to improve the fan base, if you're talking about the team perspective, but also to improve the public health, to improve equitable access to sport, to physical activity, and to all of the health benefits that come from it. I know we have a lot of technology folks in the audience. Technology can be used as a public health tool as well. Some women from my undergraduate class at Harvard created the socket ball. Nearly 20% of the world lacks reliable, safe, clean energy. That's over 1.2 billion people who instead rely on kerosene lanterns and diesel generators for their power, both of which have been shown to have negative health impacts. To address this problem, the socket ball changes play into lighting up their world, quite literally. It transforms the physical energy, the kinetic energy gained from play during the day, kicking the ball around, to electrical energy stored in a battery that can then light the house at night, providing a source of clean energy. If you don't believe that technology can have a positive health effect, you haven't watched the Paralympics. Perhaps the most inspirational sport event that there is. Each one of these individuals, and the many more who aren't shown on this slide, is positively impacted by technology. Their personal health, physical and mental, is forever changed. But perhaps even more impressive and more important is the change in the perception about these differently abled people. I use those terms specifically. Differently abled. Their bodies might not allow them to participate in sport without assistance, but with assistance, with the use of technology, not only do they benefit, but the community of differently abled people benefits as well, from a greater understanding of the true abilities of these individuals, of these athletes, and of these national heroes. So sport is part of the health puzzle. It's an important part of the answer. It is only that. It's a piece of the puzzle. It cannot be the entire answer, but as demonstrated today, many facets of sport can lead to many positive health benefits. We need to make sure when we implement programs that we do so in a way that also minimizes the risks, including appropriate safety equipment, safe fields, appropriate training. So the keys to success for implementing sport as a public health tool are many. Utilize the infrastructure that's available, whether that's the schooling system, the local sports team. Involve key stakeholders. Many of these programs, and the many more that I did not discuss, involved important people, important organizations that could communicate through the universal language of sport to engage an audience on perhaps the most important topic of health. Utilizing the dual benefit approach as outlined by the United Nations, allowing for sport to do its job in gaining the participatory health benefits, physical health, mental health, and social well-being. But also using sport as an opportunity, as a platform for communication, for engaging your audience on the most important topic of health, for engaging your audience on what matters in your community, whether it's HIV and AIDS prevention, whether it's obesity, whether it's physical literacy, whether it's mosquito-borne illness. You can use sport, the engagement of sport, to communicate about these important health topics. You can use sport to mobilize socially. But perhaps the biggest key to success are people like you, sitting in the audience today. People who are invested in sport. people who are invested in innovation. We have government officials. We have students. We have athletes. We have league organizers. We have branding and media experts. And more, all surrounded about the topic of sport. If we can leverage this, sport as a platform, and innovate around the idea of health, not only will we leave here with an engaged community of the Sport Innovation Summit, but we will leave here with a healthier world. Thank you so much.